to turn it on, it's right here. This doesn't have any alarms on it, so that's not something that's going to alarm with the patient. He uses this when he's having trouble with his coughing because his muscles are so weak, so he has trouble having a strong productive process, so this one it does. And what you do is you press therapy, and it's going to push air in and then suck it out as fast as it pushes it in, and that produces a cough. So it's real loud, but he covers his nose and his mouth with it right here, and then it'll push in real hard, and then it sucks it in. You can see it sucking my hand how hard it does, and that produces a cough. We give him like 3 or 4 times with that, and then put it on standby for a little bit, let him catch his breath, cough, suction if we need to, and then they do it again. It has to create a seal, or it's not as effective. And sometimes the masks go flat, like this one is. I just pulled it out, just get a syringe, put a little bit of air where it seals around the face a little bit better.
How often do you need to change the mask and the tubing?
That varies on how often he's having to use it. Every 3 months we'll go out and check the patient, and then we check it, and if he needs it, then we replace it for him with the machine. But it's always done with a mouth. Some do it with a mouthpiece, but Mr. Sturkin is not able to do it with the mouthpiece. He does use the mask with his.
Okay. So what do you look for when it's starting to look like it's time to change that stuff?
It'll start rearing, start causing irritation on his face. It's when you put air in it, it doesn't inflate anymore. The mask is beginning to get pretty old. If he coughs up in it, sometimes the tube, they're taught how to wash it properly. We tell them to wash it after each treatment, warm soapy water, let it air dry.
Does he have an extra at home if it needs to be changed?
I'm pretty sure he does. I'm not his therapist, but she's good about leaving him extra supplies there.
I know we don't have that here.
Yeah, but all he's got to do is contact us. We're always that way, and we can drop that off to him. This does have a filter in the back. Right here, he's to take out once a week, wash it, paper towel it really, really good, and it pops back in. And he has a battery in his because he traveled there for a little while, so if his power went out, he's still able to use his offices. The battery goes right here. I'm going to show you on the vent how it pops in and pops out, but we have placed the battery in the back of his.
And how long does the battery last?
It'll last up to 4 hours, so he's going to get probably 6 good treatments with it.
We did talk about this yesterday. We talked about hurricane preparedness. Is there a plan for him if the hurricane comes and the power goes out?
Yeah, he will have backup battery on his vent, and normally when we have that, we try to get an extra battery to them if they're staying, but we try to make sure all patients have generators.
Okay.
So they can plug in and charge their batteries. Any questions about the offices? It's real easy. Okay, here's the vent. Okay, this is the Triology. It has a filter in the back also that he's allowed, and he has extra filters, wash, paper towel, dry. Now if he gets to the point where he needs oxygen, it also has an oxygen adapter where we can bleed oxygen into it. This pops out. So his does not have it, but he has these in case we have to. And we always try to leave a tank out there for backup in case there's a problem where they can get to it really quick. And then it pops right back in, right there, okay? Talking about the battery, this is the battery. It pops out. So once it's charged, it's charged. I mean, so if he forgot to charge his battery or anything like that, but as long as it's in the vent, it's going to charge at all times. But he can take it out and it's going to stay charged. It's not going to die down like a cell phone or anything like that. And then it pops back in. On your vent, you turn it on right here, and it's very loud. And it's going to start right down here. And it's going to give him his breath. And what he is on is a ST mode with an AVAPS mode. And what that is, it gives him one when he breathes in, one when he breathes out. And it also gives him a targeted tidal volume. So he gets that tidal volume every time with his backup rate. So he gets volume plus all these pressures, and he wears pillows during the day, and I brought those with you, if he uses it during the day, and then he has a full face mask that he uses at nighttime. Now I have they all have the bacterial filter that we have attached right here. Now the alarms that you will hear on this one is if he comes disconnected. It tells you it's low pressure because it's not getting the pressure that he needs, and then it'll tell you that I have the circuit disconnect. And I'm just blowing you over here. I didn't think about that. You can hush it right here. We always tell them check your patient first, then hush it. Then go to your log. So if you want to go in and see if he had any alarms go off, just curiosity of what's been going on, or he's been having trouble and you want to see, you can go into his menu right here, and you can go down to his alarm log and you hit select, and it'll tell you every alarm that went off while you were there last time and what happened. If he took it off, goes to the bathroom, forgets to turn it off, it's gonna alarm at him. If he takes his mask off and is asleep, it's gonna alarm at him. It's gonna let him know something's not right. And then you finish, and then you have all your information here. If you wanted to see his settings, just to review those, you can go under information. It's got all the information and how long he's used the machine.
Now let me ask you a question. Being that he's a hospice patient, how do y'all do that with change of settings as they start declining?
That was something that we would have to have a doctor's. Now on the offices, we can adjust settings on those because that's just for patient comfort of what's going to trigger that call. But as far as the vent, we have to have a doctor's prescription to be able to change them for patient comfort. Okay. Now we have this, and he has a bag on him, so his looks a little different. You can't accidentally change anything. It's not going to allow him to change anything. And when he goes to turn it off, it asks him, are you sure that's what you want to do? Do you want to turn it off before to let them turn it off? So if you accidentally bump it, it's going to pop up and ask you, are you sure you want to do this? If you accidentally hit a wrong button and it tries to change the mode, which we have all the patients locked out of it completely. But if they accidentally bump something and then it does try to change, it asks you, are you sure, before you do that. So if you just read your screen, and we tell all of our patients that, check your screen, see what it's asking you. Because if they call, we'll say what alarm's going off, and they'll read it to you. It's in red, and it says this LTE, what's that mean? And we can go over with them what that's going on.
Now, if it goes off in the middle of the night, we can't figure it out, that kind of thing, we can call y'all?
We have 24/7 on call. There's a therapist on call at all times.
Good, because she's our main on-call nurse.
Yeah, and I definitely
She does
need
on-call
that.
too.
That number needs to be programmed in my phone.
Right,
But,
we want to make sure that, they have access to
And the
y'all.
Sturkins are really, really good. They've had it a while. They troubleshoot, and I have a troubleshooting list that we do. It's a lot with our invasive and other than our non-invasive, but it's good to look at. It'll tell you different things. Sometimes you get a hole in your tubing, and that's causing low tidal volumes, and it's going to tell you we can't do it. And then you go to trace them back, try to figure out what's wrong, and it might be a hole in the tubing. But I have that. You can make copies of that, and it's really, really good to troubleshoot what's going on with the vent. Power goes off, it's going to kick automatically into the battery. It has an internal battery plus the external battery. So he has all day save on this as far as the vent. Now the offices is a little different, but as far as the vent, he can go. And it'll show you right here that the internal is full and that the detachable is totally full. And if the detachable comes out, it's going to tell you it disappears. You don't have one attached.
And it always uses the internal first.
And then you'll go to your use your detachable first if it's plugged in. Now if you unplug, and it's going to tell you, oh, you lost power. See? you lost power, you're on your battery, so be careful. When your battery gets low, it beeps at you. Your battery's low, you better find somewhere to plug up or put your other battery in. It tells you every little thing it does before it'll do it. And then when you plug it back up, it's gonna tell you, hey, you plugged me 2 batteries in 2 sources. So, like I said, it's not gonna let you do anything. And it's fussing at me because I unplugged it and plugged it back in with it on. And then to turn it off, do you want to turn it off? Yes, I do. And it's alarm. We have all alarms set on high. We won't turn them down. The patients ask us to, but we want them to be heard by the family members. So they're all going to be that loud. So,
All right.
any questions?
No.
Yeah, sure.
Don't think so. Pretty simple.
Now, his stuff, so this won't be what you see. He's got regular tubing because he has a vented mask. See regular CPAP tubing on him. Hook to here. Oh, you moved it on me. He has this mask, and then that hooks here. This hooks around his head like this. His exhalation's right here. So there's air, and if he has it on, when you come in, you'll feel the air coming out of here. That's how he's exhaling. He can take it off to wear to the bathroom. We've taught him that, but he pulls from here because he doesn't have movement in his fingers very good. Sometimes his cushion comes out, it pops right back in. There's a little crease right there. This cushion pops out. Sometimes he gets it out and he can't get it back in. We've told him in washing just to wash the whole thing because his hand movement, and his wife doesn't have real good hand movement either. But it pops right back in. So he asks us to put it back together. It just all goes right back together. And then it fits just like that. And then during the day, he wears pillows, which is this. He has his pillows on. Clear to the top of his head. Velcro goes to the back of his head. These go in his nostrils. They just sit at the edge. They're not supposed to go all the way up. Exhalations here, and it connects like this. So he will put this on during the day, and he tries to talk to you when he has it on, and the vent will alarm because he's losing that pressure, so it's giving a high leak, and it'll say low volumes, and that's because he's talking with it. So I always tell him, close your mouth, breathe through your nose, and he's not. These come off too. Sometimes he'll get those apart, can't get it back, and it just pops right back on right here. And then these come loose. Like I said, his hand motion's not real good, so sometimes when he does get it apart, we have to help him get them back together. Writing to writing is how I tell them so they don't put it upside down. And then this all hook back up. Any questions about what he wears? And we replace these when they come out. So, but he just got new supplies. I looked at the computer, so he should be good. Any questions? But as bad as y'all thought it was going to be, huh?
Easier than we thought, yeah.
Yeah.
Yep.
Him being non-invasive, it's really, really easy.
Yeah.
Because you don't have to lift the trach, or, he's not on it 24/7. So
Yeah.
that's the big plus on him. And he knows it. He forgets sometimes, but he knows his equipment really well. Okay.
All right.